which is safety and infection control. This area comprises about 5 to 11% of the questions you'll see on the NCLEX exam. Let's begin. We're going to talk first about inflammation. To understand the nursing care involved with infection control, you need to know how the body responds to infection, and it does it by inflammation. There are both systemic signs and local signs of inflammation. The local signs include swelling, heat, redness, pain or tenderness, and possible drainage. And the drainage may be bloody, which is red or bright or old blood. It may be serous or it may be purulent or pus-filled. There are systemic signs of inflammation. These include fever or elevated temperature, malaise, weakness, lymph node enlargement, elevated WBCs or white blood cells. And again, remember, normal is 5,000 to 10,000 WBCs per cubic millimeter, and also an elevated ESR or erythrocyte sedimentation rate. Any number of over 15 to 20 millimeters in an hour indicates inflammation. Let's talk about infections. There's general two overreaching topics with infections. The first we're going to talk about is communicable diseases. And you'll remember that these are caused by pathogenic organisms. They are transferred or transmitted by direct contact, by droplet, through contaminated articles, or through carriers. The other type of infection you need to be thinking about is what we call nosocomial infections. These are hospital-acquired infections. If a patient acquires an infection in a hospital, they call it a nosocomial infection. Most often, these are caused by Staph aureus. And remember, hand washing is the primary way to prevent nosocomial infections. Let's talk about prevention of infections. First of all, balanced nutrition. The 4 basic food groups, the food pyramid, will help prevent infection. Getting adequate rest, again, is a way to prevent infection. All children and adults should have updated immunizations, and use of good aseptic technique each and every time that the patient has a procedure done, again, will help prevent infections. One of the important or basic principles of infection control is the use of standard precautions. Now, at one time, these were called universal precautions, and many times now they're called either standard precautions or barrier precautions. This, again, is the primary strategy for prevention of nosocomial infections. The thing to remember with standard precautions is you use them 100% of the time with 100% of your client. And dealing with standard precautions, it happens anytime there is exposure to blood, all body fluids, secretions, and excretions, anytime you come in contact with non-intact skin, and anytime you come in contact with mucous membranes. And what is done with standard precautions, first and foremost, again, is hand washing. Good hand washing. You would do good hand washing immediately after contact with blood or body fluids if it was an unexpected occurrence where you didn't have gloves on. Even when you wear gloves, you wash your hands as soon as the gloves are removed. You wash your hands in between patient contacts, and you wash your hands when you're dealing with the same patient, but in between specific procedures or tasks with the very same patient. Another component of standard precautions is the use of gloves. You use non-sterile clean gloves whenever you touch blood or body fluids. You would put gloves on before you come in contact with non-intact skin. You would change gloves between procedures or tasks. And once you have completed a task, you remove gloves properly, pulling them from the outside, covering them over and down, and dispose of them properly. Another component of standard precautions is masks, eye protection, and a face shield. You would use this type of equipment anytime there is a chance of sprays or splashes. Again, these can't always be predicted, but in some cases, if you're dealing with tubes and all and there's a chance of a spray, you should use the masks, eye protection, or face shield. And the last component of standard precaution is gowns. You will use gowns again when there's a chance of spraying or soiling, splashes going on. Again, if the gown gets soiled, you would remove it promptly and dispose of it properly before leaving the patient's rooms. Another component of standard precautions or barrier precautions is appropriate handling of needles. You never recap a needle. You never bend or break a needle. They are always put in biohazard containers, and there should be a biohazard container in the patient's room or in every patient care treatment area. If the container gets full, again, it should be disposed of properly. They're never emptied. They are taken off the wall and a new one reapplied. Now, some of the other issues with regard to standard precautions, first of all, is patient placement. This is a topic that is frequently tested on the NCLEX exam. You would put a patient in a private room if the patient has poor hygiene practices and they contaminate the environment, or if the patient cannot assist in maintaining infection control precautions. For example, an infant or a child who is unable to comply with certain regulations, or if you have an adult that has an altered mental status. Again, the patient placement in a private room should be done. Another issue with regard to patient placement is what we call cohorting. Cohorting is where they share a room, where you assign a patient to be in bed one of a two-bed room. And when you cohort patients, or you assign them to particular rooms, you need to take into account the epidemiology of the disease process and the mode of transmission. For example, you would never put people in a room that have different infecting organisms, because what you'd end up with is two people that have two diseases rather than one person with one disease each. So again, that's an important consideration. You take a look at the epidemiology and the mode of transmission before you would cohort a particular patient. Another issue with regard to standard precautions is transporting clients. Whenever a client with an infection is transported, you would use barrier precautions or have the patient or client use barrier precautions. These may be masks if it's droplet spray. For example, if you're moving a patient with tuberculosis, again, they would wear a mask as they go from place to place. If you have a patient with a draining wound, you would put an impervious dressing, something that could not leak out and contaminate the environment. Now, if you're transporting clients with infections, it's very important that you notify the place you're going to expect the client so they can have things ready for you, and let them know what precautions are needed. Are they going to have to go into a private area? Are they going to need to be screened from other patients? Again, when the patient is being transported, you need to let the patient know what they can do to help prevent transmission of infecting organisms as they go. Covering their mouth when they cough, or different things such as this. And again, it's very good to involve the patient in the care if at all possible. Let's talk about some of the different type of transmission and what the specific precautions are based on the mode of transmission. The first one we're going to talk about with transmission-based precautions is airborne precautions. You would use airborne precautions anytime the transmission is airborne. For example, rubeola, which is measles, tuberculosis, varicella, chickenpox, disseminated herpes zoster or shingles, again, all transmitted via the airborne route. What you would do in this case for airborne precautions is the patient would be put in a private room with monitored negative air pressure. You would keep the door closed, because it doesn't help to have all these special precautions and leave the door open. Healthcare workers that come in contact with the patient should wear a mask or a respiratory protective device. And again, the type of patients that would have airborne precautions perhaps would be a patient with TB or chickenpox. Another type of transmission-based precautions is droplet precautions. This is where the infecting organism is transmitted by droplets. An example of this would be pneumonia or meningococcal meningitis. In the case of droplet precautions, again, the patient needs to be in a private room, or you could cohort them with someone who has the very same infecting organism but nothing else, again, because it's transmitted by droplets. In this case, you can have the door open, because it's highly unlikely that a droplet will get from the patient's bed and way out the door, which hopefully is across the room. With droplet precautions, you should maintain a spatial relationship or separation of 3 feet between the patient and the visitor. So there should be some space, again, so the droplets have less chance of getting from patient to visitor. The nurse, when caring for the patient, should wear a face mask. And again, the patient should wear a mask if they're transported or go outside the room. Again, a good example of a patient who would need droplet precautions would be a patient with pneumonia. Let's talk about the next type of transmission-based precaution, and these are contact precautions. A good example of a patient needing contact precautions are patients with multi-drug resistant organisms, or MRSA. In this case, again, a private room is required. The nurse would put on clean, non-sterile gloves before entering the patient's room. The nurse would put on a gown if the nurse's uniform will have contact with the patient or surfaces in the room, again, because that's where the organisms would stay. The nurse would be responsible for removing the gloves and the gown before leaving the room. They would stay in the room. And again, a good example of a situation that would require contact precautions is MRSA. And again, we're going to talk a little bit more about contact precautions as we talk about the different disease processes. So those are the type of precautions based on the mode of transmission. And again, it's an important topic, one well worth your time to kind of go back over and review, as is standard or barrier precautions.